Now he started working with us and immediately saw those types of benefits we were talking about. Sugar levels coming down, coming off of medications, losing weight for the first time really in decades for him. And he ultimately lost, I think he's lost well over 250 pounds at this point in time.
Hello and welcome to The Nostalgic Advocate with Michael Eichten, your host. I am so excited because today we have with us Dr. Frank Dumont with Virta Health. And Dr. Dumont is a commercial medical director and clinical lead at Virta Health. He's trained in internal medicine, lives in Estes Park, Colorado, at the eastern entrance to Rocky Mountain National Park. What a beautiful spot. Prior to joining Virta, he was in a community hospital-owned practice for nearly 20 years. He practiced outpatient and inpatient medicine and was the medical director of the wellness service line for the medical center. As an undergraduate, he studied physics and music, and he pursued his medical training at the University of Colorado Health Sciences Center. He has been devoted to improving healthcare delivery for over 2 decades, participating in organized medicine as a young physician representative to the AMA and serving on the Colorado Medical Society Board of Directors. He is a fellow of the American College of Physicians. We first met, I believe it was about 2018, with my former employer. Dr. Frank Dumont was our speaker. He was talking to our group about the diabetes reversal process, which as a licensed insurance agent for nearly 40 years, that was something very new to me to hear diabetes could actually be reversed. And we're gonna find out a lot more about that. But first, Dr. Dumont, would you tell us a little bit more about your career path and kind of what was the big change from a family practice to joining Virta and why?
All right. Well, thank you, first of all, for speaking with me today. It's really great to connect with you again, and I'm really looking forward to the discussion. I started practicing medicine back in the end of the 90s, and so I've been doing this for quite a while. I went into internal medicine because I really liked the idea of the complex problems. I really liked the idea of being able to look at all of these things happening in the body and trying to pull it apart in a way, take a look at the various aspects of it, and eventually put it back together for that person to try to help them live a healthier life. But unfortunately, what I found after doing this for about 15 years or so was that I was getting pretty disheartened. I was watching most of my patients get sicker over time. And that was in spite of everything that we were doing as a system, everything that our hospital system was trying to do, all the things that our educators and, diabetes educators and nutritionists were trying to do to help people, everything I was doing as a physician, including prescribing a lot of medications. I felt like I was adding in more and more medications and still watching people get sicker and sicker. And that eventually led me to being interested in maybe pursuing or focusing on some other aspects of medicine just to keep me really engaged and energized. And that led me more toward thinking more about exercise and altitude and athleticism and nutrition. And the interesting thing is that just kind of circumstantially, I happened to be in the right place at the right time in a couple of ways that allowed me to be exposed to the literature behind what we do here at Virta. And that's the literature of trying to help people lower their carbohydrate intake enough to see their metabolism improve. And once I started to see the power of that, once I started to see how consistently that worked and how well it worked, what the magnitude of the effect was, I couldn't unsee it at that point. Once I had started to see that, then I wanted to talk to my patients about it more. What I started doing was introducing that more and more into my clinical practice. But of course, for one thing, that's a little bit at odds with a lot of what you see in traditional medical care, in the usual medical practice. And in addition to that, my system, the clinic that I worked in, just wasn't set up to do this in the way that we're able to do it at Virta. And so, what I really decided at some point in time is I wanted to be able to do this better, to really take advantage of this aspect of the science and really help people be able to do it and do it well with a system that really supports them doing it. And that eventually led me to this company and what I've been doing for the last 6 years.
Oh, well, that is awesome. Well, I know that we've seen this at work, and you inspired me back then to really change my perspective about type 2 diabetes. That the fact that it wasn't a sentence of medication for the rest of a person's life, that there actually was some significant hope. And, what I'd like to know, and I think our listeners would really like to know is, so what is Virta's primary philosophy or guiding principle in reversing type 2 diabetes? How does this happen?
Well, so let me take a little bit of a step back and talk about type 2 diabetes. So what we know is that metabolic disease is really rampant in our country, type 2 diabetes being one of the more common and more severe problems that we struggle with. But at its root, at its core, it's a problem of insulin resistance. The body has, for a number of reasons, genetic, epigenetic, environmental, and we can go into all of those if you want to. But for all of these reasons, the body has stopped paying attention to insulin the way that it should. And what that means is when people eat foods that are higher in carbohydrates, and these are the type of foods that are broken down into sugar and end up in our bloodstream as sugar, our body, because it's ignoring the insulin, doesn't do as well handling it. So we've really developed, in a way, an intolerance of carbohydrates based upon that insulin resistance. And so our philosophy, our approach, and this is now well founded in decades of science, is that if you can help someone lower that carbohydrate intake enough that their body can actually tolerate it. And that threshold is different for every person, but it's easy to read the body and to see where it is. If you can lower the carbohydrate intake enough for that individual, things start to improve dramatically. And this actually affects things like the sugar level in the context of diabetes, but it affects many other aspects of metabolic health, including weight. So we are a nutrition first company. We really believe that if people are interested in trying this approach, that for the majority of them, if they're given the right information, the right support, the right tools, that they can actually listen to their body, adjust what they're doing nutritionally in a way that is enjoyable, with real foods that are enjoyable, that one can do for the long term, that they can actually turn around the course of a disease that was previously thought to really be chronic and progressive and would only get worse over time and would only require more medications over time. And in contrast, we're offering this message of hope, which is that is not the case. You can actually turn it around, get the sugar levels where you want them, lose weight, improve cardiovascular risk factors, etc., and at the same time eliminate medicines that become unnecessary or less necessary. So it's a very different approach, a very different philosophy, but it's based upon that particular aspect of metabolic disease, insulin resistance, but that you can actually work on that very directly by simply changing around the types of foods that you're eating.
Well, that is actually that is just fascinating to me, and it's really hit close to home here lately. My mother has been type 2 diabetic now for more than 20 years. And so I was at least a little bit familiar with her situation. I personally crossed the line back in August. My A1C was 6.6. And so my doctor, gave me the startling news that I was now a diabetic. Since that time, though, I'm happy to report that I've made huge strides in lowering that A1C and also glucose levels, cholesterol, and hey, I actually lost 20 pounds in the process, and that was why while I was on a trip 2 weeks in Ireland, so that wasn't easy to do. And so it kind of leads me then to ask the question, though, is it reversal or is it remission? So I now have an A1C that is well in the normal range, or at least that's what my reading was last Monday. So did I reverse my diabetes, or is my diabetes in remission?
Yeah, it's a great question. And I think we try to be really careful about the phrases or the terminology that we use. We do not talk about a cure of type 2 diabetes, because that root problem that we talked about, that insulin resistance, once that is developed in someone's physiology and their metabolism, it appears to be something that remains. And so that is not something that goes away. It might improve some for a number of reasons. So, for example, if someone loses weight, often insulin resistance will improve, which of course makes it easier to lose weight. But, that doesn't take away the insulin resistance. And so what we believe is that we can actually turn around the course of the disease. And so that's what we mean by reversal. So someone's heading in a direction, worsening, getting more and more medications, they change what they're doing nutritionally, as it sounds like you've done extremely effectively. You head in the other direction, the numbers get better, and you require less and less in the way of medication support. That's turning around the course. It's reversing course. So we talk about reversal as being that process of turning it around. Remission, of course, is the goal. Because ideally, what we would like to be able to do is help people reach a point where they are no longer in the diabetes range, no longer requiring medications, and remaining there, sitting there at that point in time. Now, if someone says at that point in time, now I'm going to go back to what I was doing before, eating more processed foods, more carb-heavy foods, eating more sugars, the bottom line is that insulin resistance is going to manifest again. And the last piece that I would say is that when we first started doing this, Virta has been around since 2015. And when we first started talking about diabetes reversal, we actually got a fair amount of pushback. People saying, did you just make up this term? That doesn't make any sense at all. This is a chronic progressive disease. But fairly recently, the American Diabetes Association and their international counterparts actually got together and published a consensus paper clinically defining diabetes remission and diabetes reversal. Because there are ways of doing that, whether it's bariatric surgery or whether it's this type of a nutritional approach. We know that it actually can be done. They agree with that. They've actually published on it now. And so it's become a part of the diabetes landscape, and I think is becoming more accepted.
Wow, that's absolutely wonderful news. And so, what I wanted to ask you about is, as a person follows this program that Virta offers and takes back control of their health, and let's say they do lose weight sustainably, how is that actually how is that actually reversing their type 2 diabetes, and what other benefits might there be for following that process as opposed to a traditional modern medicine, just drugs and insulin?
Well, so there are a lot of questions that are kind of built into that. And so if I don't adequately answer this, redirect me. But I'll start out by talking about usual care, what I was taught to do in medical school and what I did for 20 plus years, which is to try to manage the condition. I was told that, yes, it is important to focus on things like nutrition and exercise. And so I would talk to patients about it. But I believe I was actually trained to be very pessimistic about this. I was trained to be a medical pessimist. And in fact, it was built into many of our recommendations where they would essentially say, sometimes in between the lines, you can talk to people about diet and exercise, but it's not going to be effective enough. So you need to be very aggressive about starting medications early and be as aggressive with them as you need to be to achieve control. And so that's really a lot of what I did. And that included aggressive use of medicines like insulin. And so in general, even though I would talk to people about nutrition and about exercise, it wouldn't be the focus of the visit. I would spend much more time focusing on the medications. And in general, what I saw over 20 years was things getting worse. So the medicines would help. They would push the A1C and the glucose levels down, and A1C being that marker of kind of what the glucose control has been on average for the last 2 to 3 months. It would push those down, but it would only last for a period of time. And then the disease would progress and the numbers would start to climb again and people would gain more weight. And so we would add in more medicine. And then the same process would repeat again and again. So that's usual care. That's what we expect to see, is that gradual worsening and a focus more and more on more and more aggressive medicines with more and more side effects. And just to talk about, kind of where that leads you, when you're talking about really aggressive insulin treatment, when it's multiple injections per day, long-acting insulins and short-acting insulins, what we know is that insulin, yes, it can push sugar level down, but in the long term, it is just not a great answer for type 2 diabetes. It's the answer for type 1 diabetes, where a person can't make insulin. Yeah. But for type 2 diabetes, when the body's ignoring insulin, just to say we're going to keep shouting at it louder and louder with more and more insulin, leads to all kinds of problems, including weight gain, including increased inflammation, possibly increasing the risk of cancer in certain situations. And it even increases the risk of cardiac events like heart attack. And so we're giving people these medications to try to help them be healthier, but they carry such profound side effects that in many ways we're also helping them to be sicker. And so that's part of why I became so frustrated, is here I was doing my best to help people, and there was a side of me that really felt like I was helping them to be sicker in the long run. Now, in contrast, what we're doing is very different. We're matching up the nutrition to the metabolism. And you were asking about, some people lose weight. How are they actually reversing the diabetes? I will just start out by saying that the power of getting the nutrition right is really the key, and it works very, very quickly. And so what we see routinely with people is that they start making a dietary change that actually matches up with their metabolism. And long before they've lost weight, long before anything else has occurred, before they've started exercising because they're feeling better, what we see is the glucose levels improve dramatically. They drop like a rock sometimes. You'll see people that have sugars that are in the 200s or 300s, and all of a sudden they're in the mid 100s and getting down into the low 100s. And so to give you an idea of just how quickly this works, for someone that comes to us on insulin, let's say they're just on a once-a-day long-acting insulin, but on a pretty good dose of it. Usually, even within that first week, we're decreasing the insulin by more than 50%. And you can think about
the
what
first
that means
week.
within the first week. And so again, it's not that you lose weight and it helps to turn around the diabetes. It's just that you're not fueling a fire with that fuel anymore. And when you do that, things improve very quickly. And so, that's really what we're trying to do. And it's at the heart of all the nutritional interventions we do, whether we're trying to help people with diabetes or prediabetes or help them lose weight. It's the same root problem. It's that relative carb intolerance due to insulin resistance. And if you get the carb intake right for that person, and it is different for each person. Some people might be able to tolerate 30 grams of carbohydrates a day. Some people 75 grams of carbohydrates per day. Some people 150. And so, but we can listen to the body objectively, help them get that right. And that just turns things around very quickly. And then if you continue down that pathway, where you say, okay, this is obviously working for my body. I'm going to do more of this. I'm going to double down on this. What we see is people being able to come off of the majority of their medications for diabetes, their diabetes-specific medicines, within the first few months, to get their sugar levels back below the diabetes range, so out of the diabetes range of A1C into the pre-diabetes range and even below. And we see other things start to improve as well. Then we start seeing other aspects of metabolic health follow. And so to your question about what else improves, well, we've talked about weight loss a little bit. And I guess I'll digress for a moment just to remind people that insulin is our weight storage hormone. It's our fat storage hormone. So when insulin levels are high in the body doesn't want to burn fat. It wants to store fat. That's what that signal is telling the body, is put that, anything that you can, any of that fat that's in your body, put it away in storage. And so it's one of those things that is so frustrating for someone doing traditional diabetes care to be told, take this insulin and work on losing weight. Well, we're giving them even more insulin, and their body's cranking out as much insulin as it can, trying to push the sugars down. And we're asking them to lose weight, even though all of that insulin is telling their body to store fat and is making them hungrier. So, it's one of those things where we really start to see the weight loss happening pretty consistently. Where on average in our clinical trial, we saw 12% weight loss in our patients with type 2 diabetes by the end of the first year without focusing on weight loss. We're not asking people to lose weight. We're asking them to eat in a way that works for metabolic health, but that results in weight loss. Other things that improve: fatty liver disease, what's now being called metabolic dysfunction associated fatty liver disease, that improves dramatically. The liver health improves when you get this right because you stop storing fat in the liver. It appears that other things improve as well, including cardiovascular risk factors. So when you're looking at things like blood pressure, that improves. Lipid parameters, so the cholesterol panel, things like the triglycerides go down markedly for most people. HDL cholesterol goes up markedly. Those are the types of things that decrease the risk, the calculated risk score for cardiovascular events like heart failure or heart attack. So a number of other things improve metabolically as well. And we could spend probably an hour talking about it, but we've had a number of publications that we put out, peer-reviewed publications from our clinical trial, showing these other ways that people got healthier: improved quality of sleep, improved depression scores, improved arthritis pain and functionality in their knee. And so some of those aren't surprising. You lose weight, and you start being a little bit more active, maybe your knees start to feel better. But in my mind, it's really exciting just to see people improving across so many fronts. When you address one problem, it just happens to be the root cause for so many of the metabolically associated conditions. It was a long answer to a short question.
It's great, though. So what I'd like to focus on for a second, and I think this probably would be really good news to our audience today, because it certainly is to me. It sounds like exercise is not a requirement, that, just balancing your, nutritional needs is really the key. But I'm assuming there still is benefit for exercise or movement. How would you like to comment on that? Not to discourage people, but I know for me personally, I like getting out and moving, walking, running, and, try to be fairly active, I'm assuming that also helps. So can you comment more on that?
Absolutely. So there are a couple of aspects to this. I'm going to start with, I think one of the reasons why, and we get a lot of questions about this, saying, well, why don't you all support exercise? We absolutely do. Exercise is one of the best things that people can do for their health. But what our clinical trials showed, when we started that and ran that for 5 years, starting in 2015, what the trial showed was that even if people didn't exercise, they had equally good outcomes. And so I think what that means to me as an internal medicine doctor is not that exercise isn't important. It's just that nutrition is probably the bigger problem for some people. And another way of thinking about that is something that I think most of us have known from a common sense standpoint for a long time. And there's even a phrase that I've heard many times. I'm a runner, I'm a trail runner. And I've heard this a lot of times, is that you can't outrun a bad diet. You can exercise all you want, but if you eat poorly enough, you will still potentially get sick. And so the nutrition really seems to be more powerful. The magnitude of the effect when you get that right is higher. And so that's really exciting to me also, because I know that some of the people that come to us are so sick that exercise does not make sense for them. If someone is struggling, for example, with weight issues to the point that they really just can't move well, and it's hard for them to even move across a room, then they shouldn't be thinking that they need to go out and exercise for 2 hours a day in order for this to be successful. They need to focus on what they can focus on. Exercise can come later. And I've got a really great story I can tell you about if we've got a moment with regard to one of our patients who just shared with us last week.
Oh, absolutely.
So let me come back to him in a second. But, the bottom line is the exercise is important in terms of improving metabolic health. And so when our patients start to feel better, when they start to actually feel energy improve, which routinely happens when insulin levels in the body go down, and when they lose weight, which makes it easier to move, and when they start to lose some of that brain fog that goes along with metabolic dysfunction and high sugar levels and such, a lot of our patients or a lot of our members really do want to move more. And then our coaches are there to really encourage that and work with them on individual goals. And so for some people, that's just getting out and trying to walk, a couple of times a day for short walks. For some people, it's just standing more when they're at their desk. For some people, it's training for an event. And our coaches will support people and actually help them adjust their nutrition to accommodate what it is that they're now working on. So the story that I wanted to tell you about is a member that's been working with us for a few years now named Michael. He's in the state of Alabama, works for the state there. He came to us weighing well over 500 pounds. He might have been 540 pounds. In fact, the story that he tells us is that when we sent him the Virta scale, which is a part of a kit that we send people to be able to track their body, it didn't work because it only went up to 499 pounds. We had to send him a special scale that actually could accommodate his initial weight. Now, he started working with us and immediately saw those types of benefits we were talking about. Sugar levels coming down, coming off of medications, losing weight for the first time really in decades for him. And he ultimately he's lost well over 250 pounds at this point in time.
It's amazing.
It's amazing. You look at the pictures of the before and the after, and you hear the description of his quality of life, how it's changed. He would talk about spending time with his grandchildren and taking them down to his pond on his property to fish. And they used to have to take one of his mini outdoor ATV type devices to go down to the pond because he couldn't walk down there. He barely could walk across a room easily. Now he actually will race his grandkids down to the pond and back. And he said he doesn't let them win because he's just having so much fun feeling like he can move again. And what he told us at one of our all-company meetings where he joined us a week or two ago was that he just did his first 5K race. He had signed up for it, decided to train for and do a 5K. And he said he came in, I think, somewhere around 400th or 500th out of 1,500 people. And he said the only reason he wasn't further up in the field was because he started at the very, very last because he figured he was going to be the slowest person. And he had to pass so many people that it slowed him down. So to see that kind of a change in someone and see him embrace exercise, I think, is really something that we expect to see and we absolutely support. The other aspect of this, and this is on a totally different tangent, now moving away from Michael's story, is that we know that a lot of people that are losing weight, we worry about preservation of lean muscle mass. When people are losing weight, we don't want them to lose too much muscle tissue. And so that's another piece of our program, is that when people are really working on more aggressive weight loss, whether it's taking advantage of some of the benefits of some of the medicines that now are available, coupling it with our nutrition, or simply working on the nutrition, either way, exercise is a part of trying to prevent that loss of muscle mass as well. So there are many ways that we make sure that exercise becomes a part of the plan. But the funny thing is, it isn't necessary to have the initial success, at least, but it's probably very good for long-term success.
Oh, that's fantastic. So, is it a boxed meal type plan? What kind of parameters are around? What specific foods can a person eat? What should a person avoid? I mean, are there some general themes that you could share with the audience?
Yeah, well, so the first thing I would say is I think part of the reason that this has been so successful and that we've been able to take what we did in a clinical trial in central Indiana and replicate that across the country with over 500 different clients and very different demographics is the fact that it is not just cookie cutter. That we are not sending people meal replacements like bars or shakes or soup mixes, or saying you have to follow this menu. Well, maybe they don't like that menu. Maybe they can't easily afford that menu. So there's very little that is set in stone in terms of how a person does this. And in fact, one of the things that I think our coaches do beautifully is really getting to know someone and the foods that they already enjoy, and starting with what do they like, and understanding what they don't like or what they can't have, or they have food allergies or food aversions or religious restrictions or whatever, vegetarian, vegan. All of those things can be accommodated because the coach can understand a little bit about their world and what has the potential to really work, really focusing on how do we build from what you already enjoy so that what we come up with is something you'll still enjoy, because that's really important. Otherwise, it has the potential to be another flash in the pan where someone loses weight and then says, but I can't do this forever. So they stop and they quickly regain the weight, or they make some significant changes and they say, I can't do this forever. And then their diabetes goes back out of control and they go right back on those medicines. That doesn't help anybody. It certainly doesn't help the member. No. And so we're really trying to work with real foods, rich foods, satisfying foods. And in my mind, that's one of the best themes about this, is that we're talking about, yes, helping people learn to avoid foods that aren't working for their metabolism, but that there are so many other foods that do work for their metabolism, that are in many cases foods that we've been told to avoid previously, that now work extremely well in a very healthy way with the body in that context. And what that means is being able to eat foods that can be very enjoyable. And so the coaches are really trying to help people, again, lower carbohydrates enough, keep the protein level moderate. We need to make sure people have the building blocks they need for their body. And then as much as needed to make things enjoyable, satisfying, palatable, and good for the long term, and to give people the energy that they need to do what they're doing throughout the day, thinking, moving, etc. Then using fats as fuels as needed. So adding in fats as needed to be satiated and to feel like you have enough energy. And the funny thing is, even though this is a lower carbohydrate, higher fat approach, all of these things we've talked about with that still happen. You eat more fat, you see less fat in your liver. People lose weight. It's not what I was taught in medical school, and yet it happens time and time again if you get that one critical component right, which is getting the carbohydrate intake low enough for your body.
And how about protein? Where does protein come into the mix? Because I would assume that as a person is lowering their carbohydrate level, that maybe they're not getting enough energy. And so tell us about protein and how that might fit in the mix.
Yeah, so protein is important. I mean, it's the building blocks for all of the components of our bodies, all of our enzymes, etc. Those are made up of things like proteins. And so, the amino acids, we need to get them, enough of them. We need to get a wide enough spectrum of them. And so that's certainly a focus of what we do. So this is not a low protein approach, but it is also not a particularly high protein approach. I mean, I know one of the questions we often get when I have the chance to speak with medical directors and healthcare leaders across the country is, well, wait a second, patients with diabetes, they have problems with their kidneys. And if they're eating too much protein, doesn't that put their kidneys at risk? And so we've tried to be very intentional about how we help guide people with regard to protein. And that's one of the few places that sometimes our patients will count pretty carefully. We don't ask people to count calories. We don't ask them to log all of their foods, but we do ask them to keep track of how much protein they're getting to make sure they're getting enough but also make sure that they're not getting so much that it actually puts them potentially into a dangerous range in other ways. But the beautiful thing about that is there are many different sources of proteins, and many of those come packaged with things that can also include natural healthy fats, which actually makes them more enjoyable. So that's the kind of thing that, again, can start to become the building blocks for a particular plate, if that makes sense.
Yes, it does. It does. Well, and I know that there's a certain amount of discipline. If a person has become very accustomed to certain foods and, like to eat certain portion sizes, and all of a sudden you have to cut back on any of those, it does require some discipline. It requires some planning. How does Virta help its patients overcome those challenges of meal planning and adherence?
Yeah, so great questions in there, and I'm going to give you a couple of different facets of that as well. The first is with regard to objective feedback. I think that one of the things that has really been hard for my patients over the decades that I've seen is that we're asking them to do things that are challenging to do, and they sometimes have to wait a long time to see that things are actually working. And it's really hard for us as humans to say, I'm going to do this day after day after day, and I'm going to see in 6 months what my laboratory studies show. And if I know that I'm not doing labs for 6 months, it actually makes it pretty easy for me to fall in that trap of saying, well, I'll cram for the test. I'll do kind of what I'm doing, maybe make a few changes for 5 months, but the last month I'll try to kick it in. And that's really not what we're trying to do. We're trying to help people be healthier every day. That's why the objective feedback in real time is so helpful. So we send people equipment that allows them to see into their metabolism on a daily basis. And it's looking at things like glucose. And if it's appropriate for them, looking at ketone levels from their blood, looking at their blood pressure, if that's appropriate, looking at weight, and listening to their body in real time. And that real time kind of feedback, I think, could be extremely important in terms of, number one, teaching people. So someone can try something and say, oh, I thought that nuts were healthy, but maybe having 3 handfuls of nuts doesn't work for their body, right? And so you can do those experiments with your coach and say, what is my body telling me in real time, and how do I adjust in real time? And if things start to go in the wrong direction, you don't have to get way off of the tracks and then have to try to fight your way back. You can actually say, oh, that's interesting. How that number looked today is very different from yesterday. Let me think about yesterday a little bit, maybe touch bases with my coach about it and come up with a different plan. So that real-time feedback is not only very educational, but it's also very reinforcing because people who have seen their numbers get worse year after year after year, and now they see them getting better, a lot of times really like the idea of saying, how much better can I make this? So it's very reinforcing from a behavior standpoint. Now, the second part I want to talk about with this is the neurochemistry of it. And this goes into probably more than we have time to talk about. But what we know is that we as humans really function based a lot on habit loops. That basically there's some kind of a stimulus in the world. It triggers centers in the brain that, cause pleasure, our pleasure centers, that reinforces the habit. We go back and do it again. And so that is something that actually ends up being basically wired into our brains. And so maybe that's something like eating something that's very processed, very high in carbohydrates, and maybe coupled with fat, like a donut. Let's use that typical example. So I start to have a lull in my energy level during the morning. I say, oh, wow, I'm kind of craving a donut. I go grab a donut. I eat that. And that triggers the pleasure centers in my brain and tells me to do this again. It reinforces that habit loop, which makes it easier for me to do the exact same thing tomorrow. Well, one of the things that we know is that the way that we teach people to eat doesn't reinforce those habit loops. That fat doesn't do that. Fat combined with carbohydrates, processed carbohydrates, does that. But when people start eating in a way that works for their metabolism with lower carbohydrate, it doesn't trigger that pleasure center the same way. And what that means is we stop reinforcing that habit loop. And if you cannot reinforce the habit loop, it weakens. And that actually means that the brain gets better at not driving you back with that same craving. So cravings go down. And the other thing is, of course, hunger goes down because as insulin goes down, our appetite has a tendency to go down. And fats tend to be satiating. They tend to make us feel more full. And the last part of it that I would say is that our coaches really work to help people develop habits and routines and rituals. Really helping people to kind of hardwire the things that work for their body so that happens by default, as opposed to being the exception to the rule. So if you know the foods that work really well for you, then rather than getting to lunch and you're starving and you're time crunched and you're saying, what am I going to do? And you kind of know what works for you, but you also know what's available and immediate and easy or whatever, and you have to make a choice, which is hard. Instead, you set yourself up for success so that your habits and your routines and everything are set up such that you get up in the morning and what you have waiting for you is what works for you for breakfast. And lunchtime comes around and maybe you've already done meal prep so that you've got your lunch prepared rather than going out for lunch and having to pick something off of a very wide menu with a lot of things that might not work for you. You've got what you need. It's already there. So you just do the right thing by default. And it makes it easier then to just kind of establish these routines that then become very easy to do perpetually. So those are some of the aspects about it. It's what's happening with regard to behavior change. It's the neurochemistry of it. There are just many pieces.
Yeah. I have to confess, I'm now a retiree, so I'm not under that time crunch of, getting to the cafeteria at work or going out to eat with clients, which was a big part of my life for many, many years. And, so maybe it'd be good to address what would be some good tips for people that are on the go. I mean, should they pack a snack? Should they eat more meals more frequently? Or just load it up and eat one big meal a day? I mean, are there some tips that you help for, especially for people that are still in the workforce?
Yeah. So again, this is one of the beauties of having a coach that is there in your pocket 7 days a week, because they can actually do this kind of brainstorming in a way that is truly effective. So me throwing out a few ideas, I might say a couple of things that will resonate for someone, but I might say a lot of things that just don't resonate for them in their world. So having a partner to work with us that can really, throw ideas back and forth and ultimately come up with what works for you, is probably the most effective. That being said, I guess from a general standpoint, what I would say is that the more that you can plan ahead, the better. Because what we know is that our willpower, many of us think of it as being somewhat like a muscle and very fatigable. And we live in a society where we are faced with just these ridiculous numbers of potential options in our choices on a regular basis. You go into a supermarket and you say, I'm going to buy something like cereal. Well, you're looking at maybe 100 different types of cereal that you have to choose from. And every time you have to make a choice and say, this is healthier, this is less healthy, I enjoy this one more, I enjoy this one less, you make that choice, it puts you a little bit closer to fatigue, if you will. And what we know from the behavioral studies is by the end of the day, most of us stop making good choices. And we've worn out that muscle of willpower, and we end up starting to make choices that aren't the healthiest for us. So when you can plan ahead, then it takes some of that willpower aspect out of it. And it's part of what I was talking about with habits and routines and rituals. But even for people that are very much on the go, there are ways of doing that can be very time effective. And so, an example of that might be for someone that is trying to get ready for a very busy work week, doing some meal prep over the weekend, preparing something that can not only be a good meal that day, but actually could then provide for leftovers for another 2 or 3 meals during the course of the week. That can be helpful. If you're someone that does eat out a lot in the course of work, for example, or travel, finding restaurants, because we have so many chains now, finding restaurants that work for you and have certain menu items that work actually extremely well. So, for example, if you tell me that I'm going to a particular restaurant like Chipotle, take for example, I know what I can eat at Chipotle that works fine for me from a metabolism standpoint. Even if you send me to McDonald's, I can come up with something that's going to work for me at McDonald's. And just to give you an idea of how well we can do that, one of our first clients was U.S. Foods, and they're predominantly warehouse workers and truck drivers. And the truck drivers are on the road all the time. They're eating out of fast food restaurants. They're eating out of convenience stores. And yet their coaches can understand what their preferences are, what they like, what they don't like, and what's available to them in the places that they stop routinely to fuel up and to take a break. And they can make that work. And we've shown that. We had wonderful results with them, just like we did in the clinical trial. So preparing in advance, thinking about it in advance, planning out, if you know what the restaurant is, but even if you don't know what the restaurant is going to be, for example, you can learn with the help of your coach how to take any meal that's available in a particular menu and potentially just make some tweaks to actually make it work for your metabolism. So there are ways of making it work.
Oh, that's terrific. Well, we've talked about certain key things with the diet and reducing carbs. But the main thing I center on your first point, and that is just giving people hope that type 2 diabetes is something that can be reversed without medication, without going down the road of insulin. And And you've had so many success stories. I know I spent a lot of time on your website, even though I was already familiar with Virta Health. And I was actually looking forward to enrolling with one of your coaches myself, the first of this year. And I reason I haven't previously is it was not available. I'm on a Medicare Advantage plan, and that plan sponsor doesn't offer the Virta program yet, but effective the first of the year, they will be, which is very exciting for me. And so I know we've talked about the main key points. What else, though, might you want to add about Virta Health, and that could encourage our listeners to look into this for them, as opposed to going down that route of medications and insulin?
Yeah. So let me start with a couple of things. First of all, I did want to be clear, and I think we've touched on this a little bit, but in terms of the types of people that we hope that we might be able to help, that we hope might be willing to give this a shot and give it a try, are people struggling with any of those conditions that are really, centered around insulin resistance. Right now, our focus is on type 2 diabetes, but even if you haven't had type 2 diabetes yet, it works extremely well in the setting of prediabetes to help people avoid progressing to type 2 and actually moving them back into the normal range. And again, we have an increasing focus as well on helping people with regard to weight, because we know it's the same root problem. And so, for people that are struggling with weight, whether we're talking about overweight or obesity or even severe obesity, the bottom line is this kind of a nutritional approach can be extremely effective. So those are the types of people we're trying to reach. And one of my biggest jobs as commercial medical director is to help to share this message with healthcare leaders, leaders of health plans, helping with benefits leaders across the country, so that they know that this is an option that they might want to make available to their members, to their employees. So our goal is to try to have this be as available as possible to people. And the model that we always prefer is to have this be a covered benefit so that there's not a cost for individuals. We don't want this to be something that's cost prohibitive, where someone says, I'd love to do it, but I can't afford to. We believe this is something that really people have a right to have as an option as they're trying to decide how to deal with their metabolic disease. And so more and more, we're being able to reach large employers and health plans so that hopefully more and more people will say, oh, I'm interested in trying that. And it happens to be a covered benefit for me. So that's the first thing I would say. The second thing is that I don't believe that this is the right solution for everybody. I want to be very clear about that. I don't think that there is no panacea. This is a tool. It's an extremely effective tool in the setting of metabolic disease. It works much better than I ever thought was possible. And it's something that is doable for a longer period of time. It is truly sustainable in a way that I didn't believe was possible. But I don't think it's the right solution for everybody. And so I think each person needs to decide what makes sense to them, depending upon what their goals are and what their tolerance is for different changes. There are some people that say, I don't want to make nutritional changes, period. I like the way that I eat. I understand that it might be a part of my problem. I'm not going to change it. For them, working with their endocrinologist or their PCP to use medicines as effectively as possible might be the exact right solution for them. Now, that being said, we're always hopeful that that person might at some point consider another option that would help them not have to spend money on medication copays and not deal with some of the side effects of medications. But it's not the right answer for everybody. There are some people that for whatever reason say, I would really like to, whether it's environmental or just their perception of health, or ethics, they might say, I really want to do a whole food plant-based approach. And that's what I think that I want to do. Now, we can help people do that coupled with the way that we approach things as well. But some people just want to go down that pathway. And that's fine too. That can be extremely effective. Some people now are experimenting with things like intermittent fasting. And if that tool makes sense for them and is working for them, that's fine as well. That's not our area of expertise. But I guess in my mind as an internal medicine doctor, I love the idea of having multiple tools in the tool chest, knowing which ones happen to be potentially effective in a particular way, and then letting someone ultimately make their own decision about which one makes the most sense for them. And then, of course, encouraging them to listen to their body and ask the question, is this working for me? And if not, what am I going to do next?
I'm going to share my personal situation with you. So over the last 4 months, I've gone from having an A1C of 6.6 to 4.4.
Wow.
My glucose level went from over 200 to 102. My triglycerides went from 275 to 104. And I've also increased my HDL a couple of points. I think I went from 33 to 36 or 7, and my total cholesterol went down to 100. Now, during that time period, though, I have to admit, I was taking a 20 milligram tablet of rosuvastatin for cholesterol, and my physician, beginning in August, put me on a very low dose of a blood pressure medication. Those were the only two meds I was put on because I begged him for 4 months to please let me try to figure this out with a change of diet and increasing my exercise before you put me on metformin or recommend insulin. Well, I'm really pleased with all the numbers, and in particular that the cholesterol numbers and the triglycerides improved and really quickly. But I was also taking my blood pressure every single day, and I got down to a reading of that I was under 100, 100 over 65.
Wow.
Which is starting to actually get on the low side as opposed to being, more in the normal range. And so I credit the fact that I was made aware of this being a possibility from your presentation some 4 years ago. That stuck with me. And it's stuck with me, the fact that here is a medical doctor that says, hey, this is doable. And I understand it's not for everyone. It does take some work, it takes some discipline. But had I not been informed that this was even possible, are my results way crazy? Am I the fortunate odd duck here, or is this really doable if a person takes the right approach and is coached properly?
Well, so what I will say is that, results like yours are wonderful, and they make me smile. I will never stop smiling, with regard to results like that. They don't surprise me anymore, because we see this time and time again. That when you get the nutrition right for your metabolism, your individual metabolism, all of those things that you mentioned are the types of things that improve. And it happens so consistently, that it is one of the things that I truly enjoy. And I guess maybe one of the ways that I can answer your question with a little bit more data is to go back to our clinical trial. Because one of the things that I really feel very proud about with what we do here at Virta is that we started with a clinical trial. Rather than going out to market and saying, here's what we want to do, and then we'll see if it pans out, and we'll maybe try to present on that. We said, we're going to start with clinical rigor. We're going to start with the university, run a clinical trial, prospective, controlled, peer-reviewed publications, and then, if we can demonstrate it, then we will actually start to offer this in the market to people. So in the clinical trial, what we showed in the setting of diabetes, let's just start with that very specific population, what we found was that for completers at the end of 1 year, that 60% of them, 60, by the end of the first year, had actually gone out of the diabetes range. So they had brought that A1C, that marker of glucose control, below the diabetes threshold, had come off of all of their diabetes-specific medicines. Now, in the trial that excluded metformin, we let them stay on metformin because that's used even in the setting of prediabetes. And so we weren't going to push that issue for a medicine that a lot of people said, I'm just going to stay on it. That was fine. But 60% of them off of all their other diabetes medicines and their numbers below the diabetes threshold. 60%. If you look on average, the A1C on average went down by 1.3 points. And so that was a significant drop for these people kind of across that population. And it wasn't dropping by 1.3 points the way that we've seen in all the drug trials. So first of all, I will say many drugs struggle to even achieve a 0.5 drop, right, in A1C for a population. We saw 1.3, but not by adding in more and more medicines. We had eliminated 59% of the medicines that people have been taking for diabetes. So that's how consistently it works. And I mentioned this before, but those people also consistently lost weight. 31 pounds, 12% weight loss on average. The same thing is true when we get to work with people further upstream. So in the setting of prediabetes, people that come to us with an A1C that's in that prediabetes range, 5.7 to 6.4, that if you look at the natural history of prediabetes, it's relentless. People move on to diabetes. Over a 2 to 3 year period, we expect about a third of them to actually cross over into the diabetes territory. Now, with very good programs like the Diabetes Prevention Program, the DPP, we see that trimmed down to about 15% progression. But that's a pretty resource-intensive program, and we still see 15% of people every 2 years progressing into type 2 diabetes and starting to deal with all of the complications and the costs that go along with it. In our clinical trial, we held that to 3%. And in fact, about 60% of those folks went back into the normal range, not even prediabetes anymore, but back into the normal range. And then if you look at what we were able to help people accomplish with weight, what we saw for the folks that didn't have diabetes yet, that they lost on average 13% of their body weight by the end of the first year. And it was sustained at 2 years at 12% weight loss below their baseline. Now you look at that compared to what I experienced with my patients for years, for decades, where I was trying to help them lose weight. What we know is that by the end of 3 months, with most weight loss programs, 50% of people have left the program and are already regaining the weight. And if you look at long-term studies on that, like the Biggest Loser study, where they looked at people that had been on the Biggest Loser program and they followed them up 6 years later, they had all regained the weight, and some much more weight than they had lost in the first place. That didn't serve anybody, unfortunately, to lose weight and then gain it right back and more potentially. And what we're able to demonstrate again was that sustained weight loss at 1 year, at 2 years, so different from most weight loss programs. It is remarkably consistent. And the reason for that is that the physiology and the pathophysiology below it is consistent. It's insulin resistance. And you can lower carbohydrate intake well enough in every single person, if they want to do it, to actually get below their threshold and see the metabolism start to improve. And I say every single person, I should be careful about that, but the vast majority of people can get their carb intake below where they need to have it in order for their body to start to behave metabolically.
Well, I think that's so important. And, I want to mention some statistics that I found on the CDC website. Some 12% of adults are in that diabetic range, and an additional 38% or somewhere in that neighborhood are considered pre-diabetic. And the fact that diabetes is the top healthcare expense in our nation. It's something over $400 billion annually. To know that there is an answer there for those of us that find ourselves in this insulin-resistant world, that there's hope. And I think that's what's so encouraging. That's why I wanted to have you on our show today. And I sure want to thank you, Dr. Dumont, for taking the time. And for our listeners, we will put some information about Virta Health in our notes, so people can go to the website. And I know the clinical study is on your website, as well as a number of testimonials. So hopefully this will open the door for folks if they either have Virta Health available to them through their employer or insurance carrier. And if they don't, maybe they can ask their employer, why not? Anything you'd like to add before we part today?
Well, a couple of things that I would just add. First of all, if you're curious, and you go to the website, you can inquire and work with one of our enrollment consultants to find out what you might qualify for and what you don't. There's no commitment to that. And so if you're curious and you just want to ask more questions, that's okay. That's why we're here. And we're fine if you ultimately say, not right for me or not right for me at this time. But we're still happy to answer questions. The last thing that I will say, I think I'm just feeling at this time of year a little bit philosophical about just, what my journey has been as I kind of reflect on the last year. And one of the things that I really enjoy about where I am now is that I feel like I'm learning every day. When I came out of medical school and residency, I had been learning an awful lot for 7 years straight, drinking from the fire hydrants or the fire hose, so to speak. But there were a lot of things I thought I knew pretty well. And the further I've come into my profession and professional life, I think the more that I've learned that I don't know. I've actually reached a point that there's very little I know for certain. And so I'm always asking the question, what else? What don't I know? What can I learn? How can I help people a little bit more? And so I think that's one of the things that I would encourage people to do, is even the things that we think that we know really well, that we've been told before, maybe many times, maybe by very credible experts, is that it's always okay to take a step back and say, well, what are the data showing now? Is there a reason to question some of the things that I thought I really knew? And does that open up pathways for me that weren't previously open?
Wow. Well said. And I want to thank you again personally, because you changed my mindset 4 years ago and probably didn't realize it. And I didn't realize at the time that I would even need that knowledge. But here I am, and I want to thank you personally for that. And again, thank you for being on The Nostalgic Advocate today. We really appreciate it.
My pleasure. Thank you.
Santa Fe black rolls day